Good morning, students. I am Dr. S. Prince Samuel, working as Assistant Professor in the Department of Biomedical Engineering. Now we are gathered here for a short discussion on a case study of a diabetic foot ulcer. Because this foot ulcer now it plays a very vital role in the society. There are a lot of people who are affected by disease, and in some cases even some of the foods have been cut due to these problems to save the life of the patient. Hence, we are gathered here to discuss about the case study and then find a solution about the diabetic foot ulcer. Let's start the discussion.
So first I will be saying the patient profile and chief complaint. So patient details is that our patient is a 58-year-old male and he is a shopkeeper by occupation. He has a known history of type 2 diabetes mellitus for the past 15 years. But his blood sugar levels have been very poorly controlled as he could not take his medications properly and continuously. Due to this, the main complaint is that it is a non-healing foot ulcer and on the right foot. So this has been present in his foot for about 3 months now. And first of all, the ulcer started as a very small blister, but as it was not properly medicated, it now has become a foot ulcer. The main reason for the blisters was wearing the tight footwears, which gradually worsened, and it has now evolved into a very painful foot ulcer.
Let me tell about patient's past history and his history of present ulcer. Patient ulcer is growing and enlarging, so that there is more amount of swelling, body pain. While he walking, he cannot walk properly because of his ulcer is getting more swelling. And the past history, patient has hypertension for 10 years. So we confirm that the patient has a high pressure, not like any other disease like sugar or thyroid malfunction, anything else. Moreover, that it is a genetical disorder because the patient's father also have a ulcer problem, and luckily he don't even smoke alcohol and he don't have any previous surgical history.
So I will tell about clinical examination. Now I will move on to the examination findings. On a local examination, there was an ulcer on a plantar aspect of a right foot, measuring 3 to 4 centimeters. The ulcer had irregular margins, purulent ditches, surrounding cellularities, and foul odor. Neurological examination showed a loss of touch and vibration sensation in an affected foot, indicating peripheral neuropathy. On a systematic examination, his vital signs were stable, cardiovascular, respiratory, and abdominal system showed on a major abnormalities.
So hello everyone, now I will tell about investigation and diagnosis. I will explain the investigations. Scan of blood sugar was very high, around 310 milligrams per deciliter. HbA1c was 9.2%, showing poor term or long control of diabetes. A wound smear culture revealed the growth of sarcoidosis ulcers. X-ray of the right foot did not show any evidence of osteomyelitis, which means the bone was not involved.
Hello everyone, now I am going to talk about the treatment management and outcome of the treatment. Initially, the patient started with the reducing in blood sugar level with insulin therapy, and intravenous antibiotics were given to the patient according to the report, and also the patient underwent surgical procedures to remove the dead tissues and dead particles from their body. And after their surgical procedures, they were underwent with the counseling for food elevation and also diabetic diet counseling. After 6 weeks of continuous therapy, the patient will, the ulcer in the patient will reduce slowly, and they will discharge and given advice with strict follow diet and follow-ups.
So now we have discussed a lot of points regarding the diabetic foot ulcer. So we have found some solutions that early diagnosis through some kind of wearable devices based on technology can solve this problem, because any disease generally we say if it is found at the first stage we can find the solution, because when it is found at third stage there are people who live without some organs. For example, maybe a patient will maybe living with one kidney or a few amount of liver will be taken from the body. In some cases, half of the leg is cut due to this problem. We have to avoid these kind of situations, because this kind of situations give a mental stress to the patients as well as the people who are taking care of them. Both of them will get affected. The entire family happiness will go. The entire family situation will change everything. So we have been discussing the case study and implementing the IoT solution, wearable and telehealth technology, and these cases can be solved easily through proper diagnosis and proper monitoring of patients. Thank you.